Yeah. Coming to the first slide, basically, let's understand what the term hepatitis means. It means inflammation of the liver. And hepatitis can be caused by various other causes other than viral hepatitis. Causes like heavy alcohol, autoimmune, drugs, toxins, all these can cause inflammation of the liver. However, the most common cause remains viral infection. And hepatitis A, B, C, and E remain the most common causes, and they cause from mild and self-limiting infections to very severe illnesses. The inflammation, if it is less than 6 months, it is termed as acute, and if it is more than 6 months, it is termed as chronic. Next slide, yeah. So in this figure, we can see the virion, and hepatitis A and E. It is a naked virus. There is no envelope around it, and hence this is the virus. This is a virion which can be isolated from the stool and feces. And this is a quasi-enveloped virus, which is again seen in A and E. And this is a virus which can be isolated from the bloodstream. And a conventional enveloped virus will be seen in hepatitis B and C. Now, coming to the differences between various viruses, hepatitis B is a double-stranded DNA virus and it is an enveloped virus, whereas the other viruses, that is hepatitis A, C, and E, are single-stranded RNA viruses, and there is no envelope for hepatitis A and hepatitis E virus. And hepatitis A belongs to the family Picornaviridae, and Hep B belongs to Hepatinaviridae, and Hep C belongs to Flaviviridae, and hepatitis E belongs to Hepiviridae. And the route of transmission is fecal-oral for hepatitis A and hepatitis E, whereas parenteral route of transmission is seen with hepatitis B and C viruses, and vertical and sexual routes are also present for hepatitis B. And there are no carrier states for hepatitis A and E virus, whereas carrier state is common for hepatitis B virus, and it can also be seen in hepatitis C. Incubation period is similar for both hepatitis A and hepatitis E, which is between 15 to 50 days, whereas the incubation period is 50 to 180 days for hepatitis B and 40 to 120, that is almost around 4 months for hepatitis C virus. Chronicity can be seen in Hep B and Hep C, and most commonly children are affected in hepatitis A and young adults in hepatitis E, whereas adults and of any age can be affected in hepatitis B and C viruses. Next slide. So coming to the differences between hepatitis A and E, which are both don't have an envelope with similar incubation period, and hepatitis E virus can also affect adolescents, that is genotype 1 and 2, young adults, whereas genotype 3 and 4 will affect middle-aged and elderly men. Asymptomatic infection can be seen in both the viruses, cholestatic features can be present. But relapsing and remitting features will be present in hepatitis A but not in Hep E. And persistent infection not seen in hepatitis A, but it can be seen in hepatitis E virus, especially in genotype 3 immunocompromised patients. Acute liver failure, although seen in hepatitis A, is usually rare, and it will be seen in hepatitis E with up to 25% mortality. Coming to the extrahepatic manifestations, neurological manifestations are rarely seen, and in the form of meningoencephalitis, mononeuritis multiplex in hepatitis A, and neuralgic amyotrophy in hepatitis E virus. Rash is rare in both. Myocarditis may be seen, and features like arthralgias and myalgias can be seen in both the viruses. And renal manifestations in the form of glomerulonephritis can be seen, and GI manifestations in the form of pancreatitis, mainly for hepatitis E, it has been described. And hematological manifestations, as we can see in our practice, especially in G6PD deficient individuals, there is accelerated rate of hemolysis. And hepatitis E can also cause thrombocytopenia, monoclonal gammopathy, and cryoglobulinemia. Next slide. Yeah. And coming to hepatitis B and C differences in particular. So when we come to Hep B, when the infection is seen in adults, there is a 95% clearance rate, and chronicity and progression will be seen in only 5%. Whereas if the infection is during neonatal period, and vertical transmission, there is only a 10% chance of clearance, but whereas the chronic progression rate will be up to 90%. And coming to hepatitis C, there is a clearance of about 60 to 80%, and chronic progression will be seen in 20 to 40% of individuals. And the mechanisms of immune evasion in the form of involving CD4 cell inhibiting factors like IL-10 and TNF beta are seen in both Hep B and Hep C. And a short note on approved therapies. Nucleoside analogs, pegylated interferon have been used in hepatitis B, whereas ribavirin and directly acting antivirals can be seen in Hep C, they have been used. And which is the treatment group? The treatment initiation decisions, as we have discussed, it will be based on presence of cirrhosis, ALT levels, and hepatitis B DNA levels. And that selection will vary based on the genotype, presence of cirrhosis, treatment history, and immunocompetency state in hepatitis C. The goal of the therapy in Hep B will be to achieve disease suppression, and whereas in Hep C will be to eradicate the RNA and attain SVR. And the global prevalence of hepatitis B is around 400 million, which is very high compared to 170 million in hepatitis C. And chronicity again much higher in hepatitis C infections. Now coming to a short note on hepatitis D virus, which is an RNA virus, and majority of the patients usually, if it is a simultaneous infection with hepatitis B, it is a self-limited infection. But however, if it is a super infection on Hep B, it will be a more severe acute hepatitis. And majority of these patients will have chronic hepatitis D virus infection. And how do we differentiate if it's a super infection or a co-infection? In a co-infection, IgM anti-HBC will be positive, whereas in a super infection, it will be negative. And in those individuals co-infected with HDV and HBV, they receive treatment with pegylated interferon will be the treatment. And oral nucleoside or nucleotide analogs, they have limited or no efficacy and they are not useful in these individuals. Thank you.
Thank you. Thank you. Thank you.